Yeah, you bet. So, plantar fasciitis, if a person listening isn't aware of what that is, it's when the fascia or the tissue on the bottom surface of your foot gets really inflamed. It gets tight and it gets kind of fibrotic. That can happen from a lot of different things, but common symptoms are people have pain walking, typically after a period of immobility, like when they first wake up in the morning or after they've been sitting for a while, and it almost feels like a overstretching, like tearing sort of sensation. And it can really wreak havoc on a lot of your daily function as well as exercise habits and such. So I got this lady I took care of. She's about 55 years old, and she was a very athletic. She worked out all the time, loved to go jogging, loved to lift weights, loved to go on walks with all of her friends. And she developed some really nasty plantar fasciitis a few years ago. And she tried chiropractors, but these chiropractors she had tried in the past had only been adjusting her spine. They didn't look at her feet or her knees. A lot of people don't realize that chiropractors can actually work with extremities if they're well trained in it, like I am, not to toot my own horn. But the foot has the ankle, foot, and lower leg has about 28 bones in it. A lot of stuff can go wrong. Mechanically, if your heel or some of the other bones around it shift out of position, that plantar fascia is already under tension. So it's one of those things that if you're not getting things back into better alignment and the biomechanics don't work like they should, you're going to keep having problems. It's never going to get better. So with this lady, we did a combination of chiropractic adjustments to her full spine, ankles, knees, whole body, toes to nose, as well as we did some cold laser therapy on the bottom surface of her foot to help speed up mitochondria production and help speed up healing in areas that don't heal very quickly. And we also ended up doing, towards the end of that second week, we did shockwave therapy, which breaks up fibrotic tissue. It puts like a deep impulse into the joint, kind of creating a micro trauma to speed up blood flow, stem cell production, and overall healing. So we ended up doing those things for her for a couple of weeks. And by the end of it, she was feeling completely fine and back to normal. And then once she was good, no limitation with her exercise habits or anything, one other thing that we ended up doing for this lady with plantar fasciitis was we ended up making custom molded foot inserts. Because a lot of people don't realize that custom inserts, giving yourself support in all three arches of your feet, is really important if you're going to be running around on hard, flat surfaces all day, every day. Cool. Yeah, so I like to treat people the way that I like to be treated. A lot of people, patients in our office come in and they rave about how it's like this positive, uplifting environment and they feel better before they even get seen by one of the doctors. That's because that's the kind of business that I want to work with. That's the kind of place that I want to be cared for. And now I went to all these other chiropractors for these various sports injuries I've had throughout my career. I've torn my shoulders out, I've sprained ankles, I've blown out my knees before. I've had a lot of sports related injuries. And certain chiropractors just weren't able to help me because they weren't very well trained in extremity work. So over the last 15 or so years, I've been traveling all over the country, just taking extra techniques and trainings to figure out how to diagnose, how to treat, and even sometimes prevent various types of sports injuries. I love exercise, and so I also teach a lot of our patients various ways to stabilize their joints through exercise too. Sure. So as far as a myth for plantar fasciitis that I've personally seen, a lot of people go to their podiatrist for this, and podiatrists are great for these types of problems. Please don't take me wrong when I say this, but what I've found is that they'll show me the inserts that the podiatrist makes, and a lot of the time it only supports the inner arch. A lot of people don't realize your feet have three arches. They have an inner arch, an outer arch, and one that goes across them transversely. So if you're only getting custom orthotics for plantar fasciitis supporting one arch, it will eventually cause some sort of biomechanical problem for a person. So that's one of the larger issues. And then a lot of people think they're stuck with it forever, or that it's always going to be coming back for them if they do the wrong things. And while that's partially true, you can get stuff like this corrected long term if you fix the problem and if you figure out how to support it so it doesn't come back. Sometimes there's some exercise habits need modified, some lifestyle habits need to be modified. You got to go to the right type of person to be able to help you with this. But those are two of the biggest myths: is improper footwear and just the fact that they think they're stuck with it forever. Sure. Well, obviously, setting up an appointment with our office to find out if we can help you. First appointment always starts with a consultation. We do a very detailed evaluation. One of the parts of our exam, aside from spinal EMG scans and full spine digital x-rays, is we do a foot scan on a 3D foot scanner. So it's a pressure sensing plate, measures where your feet touch the ground, how hard they hit in those areas, and it gives you a very easy to understand report that tells you if some of the problems in your feet could be helped by chiropractic or could be helped by making some sort of custom inserts. So the first visit in our office would be to figure out if that could be something we could help you with. And then the second visit, we would have a conversation about that.